Okay, so we are recording. Okay, so thank you again for joining us today as we talk about our plan for redeveloping the CHIP. And again, the CHIP is the Community Health Improvement Plan for the city of Milwaukee. And from 2017 to 2021, we referred to our CHIP as MKE Elevate. And so those two words are interchangeable. If we refer to MKE Elevate, we are referring to the CHIP. But moving into the next cycle of the CHIP, we will just refer to it as the CHIP. So kind of making that change. So our agenda for today is we're going to have an overview of the priority action areas. We're going to discuss the vision for the next cycle of the CHIP. We're going to share the timeline for the CHIP in 2022. We're going to share the CHIP charter and the MOU for action team and steering committee members. We're going to share the proposed evaluation plan for 2023 to 2028 and potential evaluation metrics. And then we're going to provide opportunities for participation and engagement in 2022. And before we begin, the reason why we refer to the CHIP cycle as like 2017 to 2021 and then 2023 to 2028 is that in order for health departments to become accredited, we do certain documentations and we follow a quality improvement process. And part of that is creating a community health improvement plan. And the way that it is set up now is that we have these community health improvement plans for 5-year cycles. And so that's why the last CHIP was 2017 to 2021. We'll be using 2022 as a planning year and then launch our next cycle 2023 to 2028. So that's where those 5-year cycles come from. So first, we're going to give an overview of the CHIP. So again, the vision of the CHIP is safe and healthy neighborhoods. And our priority action areas are economic security, inclusive and fair society, eliminate racism, and positive mental health. And in 2020, when I started in my role, Commissioner Kowalik wanted to make the statement to add eliminate racism to that priority action area of inclusive and fair society. So as we kind of review what we had decided to focus on in 2017, you'll notice that a lot of the indicators or the strategies are kind of stand-ins for racism and segregation and implicit bias. But that's really what we want to make a statement of, and moving forward into the next cycle is really start to combat different strategies that work towards eliminating racism. So now we'll use the annotate feature. So you can go ahead and put what are some priority areas of your organization. So we know that the CHIP is focused on economic security, eliminating racism, positive mental health, safe and healthy neighborhoods. But what are some priority areas that your organization is focusing on? I know there's some groups that focus specifically on like transportation, housing, job security. Are there other priorities that your organization focuses on that we could start to think about with the CHIP? Great. There's a really nice spread of different priorities here. So this is really great to see. I'll just give it about 20 more seconds.
And I'm adding in what's on the chat.
Oh, thank you, Amanda. Awesome. Okay, so I'm gonna go ahead and save this. And I'm gonna go ahead and clear everybody's responses. Thank you so much. This is really, it's really great to see, because when you register for the meeting, oh, that's mine. When you register for the meeting, I can see what your role is and what organization you're with, or even when you register for like the email list, you can see like where people work based on their email address. But it's sometimes things that organizations focus on change year to year. And so it's really great to see what everybody's priorities are, and then how can we align to those? Because if that work is already being done, we want to make sure that we are facilitating connections. And you could see there's a lot of different groups that we're working on similar things or the same thing. So really making those connections across the community to work towards a shared goal. So thank you for your participation in that. Okay, so when we look at the 2017 to 2021 CHIP, within economic security, these are the different sectors that are addressed in the plan. And so through the goals, objectives, and strategies that are currently in the plan, we are looking at fair and safe housing, healthy food access, quality early childhood education, positive youth engagement, family supporting wages and benefits, financial security education, neighborhood business development, access to job training, and advocating for a living wage policy. And so I saw a lot of these sectors and topics on the previous slide for what you're currently focusing on. But as we move into the next phase of the plan, are there pieces of economic security that you did not see mentioned in the 2017-2021 plan? Because something that we also want to do is, as we bring partners in, we want to make sure that we have strategies that are addressing a wide variety of topics and bringing in folks from all different sectors. So are there things, topics, strategies within economic security that we could incorporate? So you can go ahead and use the annotation feature to put in some pieces of economic security. Oh, that was mine too. Transportation is definitely one that we've discussed that is not in the current plan. All paid family leave, access to childcare, awesome. Parental leave, health insurance, definitely. Give it about 15 more seconds. Awesome, these are great. Building wealth, awesome. Okay, so I'm gonna go ahead and save. Awesome. All eviction. Okay, so I'm gonna go ahead and save, clear. Okay, so we're gonna look over the other two priority action areas and do the same the same activity. So when we look at inclusive and fair society, oh, you have addressed climate change and equity with expenditures and efforts needed to reduce GHG emissions. We have that one as well. Okay, so we're going to do the same with inclusive and fair society. So these are the different sectors and topics addressed in the current plan. Promote equitable laws, implicit bias and microaggression reduction trainings, community conversations and healing sessions, neighborhood beautification, reduce voting barriers, and civic leadership, specifically community and government partnerships. And so let's use the annotate feature again, and go ahead and write in. I also want to mention too that when the plan was created, again, we used inclusive and fair society kind of as a stepping stone into really trying to address racism as a public health crisis. But at the time, it was deemed too political to put eliminate racism in a health department plan. So when we're looking at the topics on the previous slide, you can see they're kind of like stepping around the fact that racism is the public health issue. So go ahead and put different topics and maybe different sectors where racism really is the focus, because we don't have very specific strategies focused on racism as a public health crisis due to that reason. Yes, definitely housing, discrimination in healthcare, gentrification. Wealth building for people of color, school funding. Oh, school funding is great. Yep. Educational opportunities, community building. Go ahead and give it about 15 more seconds. These are really great. Okay, any last ones? Make sure you go ahead and get them up. All right, so I'm going to go ahead and save good schools everywhere. All right, I'm going to clear. And then we're going to look at positive mental health. And so I will say within positive mental health, the big focus was trauma-informed care and reducing stigma. So there, as you can see, like in economic security, there was actually quite a bit of different sectors and topics that were addressed. Whereas in mental health, it's pretty focused. And I know there's a lot of folks from the mental health sector on the call. So I'm really hoping that we can get some new, fresh ideas about what we can look at within mental health. So currently within the plan, it's improve access to mental health, addiction, substance abuse resources, care coordination, reducing stigma. And that's reducing stigma of mental health, addiction, substance use, behavioral health, things like that. Trauma-informed care trainings and behavioral health. And so let's go ahead and use the annotate feature. So this will be the last annotate participation piece. But what are some positive mental health indicators, topics, sectors that we might be missing? Well, that one is excellent. Yep, services for youth. Definitely. Yes, suicide awareness and prevention is definitely something that is a big hole, I think. Children's mental health, job training. Oh, this is great. There's a lot on here. Oh yes, and this is a feature too. If there's something on here that you've thought of, you can go ahead and put a symbol next to it. I forgot about using that feature. Mindfulness training, school-based. Clinician recruitment, definitely. Yep, diversity of practitioners. Oops. Social factors in behavioral health. Green space. Violence prevention, definitely. Housing. All right, we'll go ahead and give it about 10 more seconds. This is really excellent. It's really great to see all these ideas in here. Yes, I like this one too, like the intersection of all of these different priority areas. Another suicide prevention, awesome. All right, so I'm gonna go ahead and save and go ahead and clear. All right, so thank you so much for participating. This was just one way that we could just kind of get everybody's ideas together as we start to think about redeveloping the plan. And we'll go into more detail next about what we're really envisioning over the next year for 2022 for planning redevelopment. So thank you again for participating. So next we're going to talk about planning for 2022. So we're really going to take the full year to plan for the next cycle of the CHIP. And so we have a vision for what rebuilding the CHIP will look like. And so instead of framing this as we're going to redo the CHIP or we're going to have a new CHIP, we're really just rebuilding the current CHIP that we have. And the reason for that is because when you look at safe and healthy neighborhoods and violence prevention, when you look at economic security, when you look at racism, segregation, racial health disparities, racial injustices, and positive mental health, when you take COVID-19 and the pandemic and you apply that to all of those different areas, we are actually seeing worse health outcomes within those areas than we were even in 2017 when we identified these as public health issues that we want to focus on. And so when we are framing this as rebuilding the CHIP, it really is because COVID has exacerbated the health disparities that we've seen within our priority action areas. And these are things that we want to focus on a continual basis. These are things that within the community, we need to really build these sectors and really work on these topics because they have not improved since 2017. And if anything, we've been seeing worse outcomes. And so that's where that language of rebuilding the CHIP comes from. And so the role of the health department within the CHIP process is that we really want to facilitate these meetings, these conversations. We want to align the work that's being done within the community. So as we saw in the previous slides, a lot of folks are working on similar or the same types of work. And so we really want to facilitate bringing together these groups, aligning what's being worked on, coordinate tasks and action steps, convene the partners at the table, bringing in partners who have a lot of power within the community to help the groups and help the community members who might not have that much of a voice at certain tables, and really bring those people together to make some actionable change. And then track. We really are devoted and focused on this next cycle to developing a plan that we can share on an annual basis. What has been working, what hasn't been working, have we been moving the needle on these different objectives and indicators? And so that piece is really important for us as well. And another change, I guess, for rebuilding the chip is that we're not just trying to change health outcomes, but we want to affect change at the system and structural levels that determine health outcomes. So instead of just looking at um, like a health outcome like obesity, instead of just saying we want to reduce childhood obesity, what we want to look at are the systems and the structures that are affecting childhood obesity and really aim our chip to be identifying those systems and structures and making change at that level so that it trickles down and has impact on the most people possible. And so we've created a timeline for the chip for 2022. Currently, we are working on our internal strategic planning process as well as our community health assessment. So we call that the CHA. So we have the CHA on the chip, as well as our community health assessment process. And so we are aligning the planning of the chip to these two very important processes. The CHA is a data report that we put together that has data on all different public health issues within the community. And it basically shows this is the status of these public health issues within the city at this time. So we'll actually take some of that data from the CHA and apply it to the chip. So if there are areas of emerging public health issues, we're able to incorporate that into our community health improvement plan, as well as the strategic planning process. If there are pieces that we're hearing from our staff or basically aligning the work of our department to what the community is focused on in terms of priority issues. We also want to follow the pilot MAP 2.0 process. So NACHO, which is the National Association of City County Health Officials, they recently released a grant application that we have applied to. And so MAP is the framework that a lot of health departments around the country use for their community health improvement cycle and their process. And they're redeveloping their process. And so they want to pilot some different pieces of the process with health departments. So we've applied to be one of those health departments. And so we're going to follow the pilot process over the next year. And so we've kind of aligned our work to this grant. So we should hear back about that soon, and we can share more information about that. But that's another piece of why we're going to take the whole of 2022 for this process. We also want to have a full day summit for our partners in October. And we really want to have kind of a strategic planning session with our partners when we kind of do what we did today, where we talk about what are we all working on, how can we align, where can we really make movement in the next year, 3 years, 5 years, and really have a very strategic session where we're looking at strategies and action steps ahead of releasing the plan so that we can make sure that we are bringing in a lot of strong partners who are also focused on this same work. And then in 2023, we're hoping January 2023, we'll be able to release the chip and start our action teams back again. So if you've been involved in the process of the chip, we have quarterly action team meetings. And so those meetings will start again in 2023 when we can start focusing on implementation once again. And I'm going to pause right here. Thank you, Amanda. Okay, I'm going to go to the next slide. And so this is what the timeline looks like. And I'll share this along with the documents that come with this meeting, and I'll share this on our website as well. So this is in draft format, but this is basically what we're envisioning. And so we've split it up into the 4 quarters of 2022. We'll have an evaluation report that we'll release. The stakeholder and power analyses. This is that pilot for the MAP 2.0 for the NACHO grant. And so these are the different steps that we're hoping to work on throughout from January up through July. So that'll take about half of the year. And we really want to be very focused and specific on bringing in stakeholders, addressing power within the community, and then how can we incorporate that into our community health improvement plan. We're going to look at the mission and the vision, hopefully during that summit as well during October. We're going to recruit a new steering committee. We're going to recruit a core committee, and then also recruit and continue with current action team members. And we're going to hold orientations as well for all of those groups. When we are looking at redeveloping the CHIP and updating strategies, we want to have that full day summit in October. And then once we have kind of a good list of strategies, we can kind of sort through them and identify what can we focus on first. What do we want to look at for the next year, 3 years, 5 years, 10 years, 15 years? And then we have action team activities. So within each quarter, there is something that folks can participate in through the planning process. We'll have an annual report. That's something that we're going to be doing moving forward. Is each year we're going to have an update to the CHIP process, and we'll release that. And then in January 2023, projected, we want to release the new redeveloped CHIP. So that this is kind of what we're envisioning for the next year. It's not 100% set in stone, but just so you guys get an idea of how we're really trying to take this step by step and really be impactful with how we're planning through this process. Another overarching goal that we have is to strengthen our partnerships. So as you saw in the poll at the beginning, there are a handful of folks who were here in 2017, but because we did have a lapse in engagement because of COVID, because of different changes within the health department through administration and otherwise, we lost a lot of our strong partnerships. And so moving forward, we want to implement a charter, and we want to implement an MOU. So the purpose of these are to clarify partner expectations and outline mutual benefits of participation. And this helps us prioritize recruitment and maintaining our partnerships in the next cycle. And so I will share links to those drafts as well. So the charter just really outlines what types of partners we're looking for, what types of skills it would be beneficial if you have, and really just identifies who you are, how you want to engage with us, what level you want to engage with us, and then identifying, for example, if you belong to like a hospital system, are you representing your team? Are you representing your division? Are you representing the entire hospital? What does participation for you look like? And what kind of engagement do you want to have? So just kind of clarifying for partners and people who are participating that as you come into the plan, this is kind of how we're organizing it. And then if you sign up to be, these are the different levels of engagement that I'm talking about. Sorry, I get ahead of myself a little bit. So as the levels increase, engagement and partnership increases. So if you sign up to be just level 1 engagement, it's really one-way communication from us to your organization or to you. This could just be signing up for the newsletter. You just want to stay informed. You want to hear about what's going on. But at this time, you're not able to commit to coming to all of the meetings and creating strategies. You just kind of want to be in the loop of what's going on. Level 2 is consultative. So you or your organization would commit to work on an objective or a strategy within the CHIP. And then we would also like to hear about your progress and your data throughout the year. So more of a bi-directional relationship. Level 3 would be collaborative. So you would be more of a full partner in decision making and developing. You would commit to the process long term. So when we're thinking about the 5-year cycle, we would want to maintain our partnership with you or someone in your similar role for the entire cycle. And then you would help us create policy plans, organize and develop data for the CHIP. So you would be more of a collaborative full partner. And then level 4 is CHIP governance. And so this would be our MHD team. also the steering committee of the CHIP. And so you would manage and execute decisions through strategic leadership, and you would participate fully on the steering committee. Looks like Anne asked about the CHA. Yeah, so our CHA, we're hoping to release in early, 2022. It's hard when you're doing all this planning, it feels like it's 2022 right now. So when the CHA is released in early 2022, we're gonna take data and see if there are other emerging priorities and apply those into the CHIP process as well. Does anybody have questions about these levels of engagement before we move on? I hope everybody enjoys my really beautiful design that I was working on. You don't actually have to enjoy it, but I thought it looked pretty nice. All right, so next I'm going to pass it over to Amanda, and Amanda is going to review evaluation. So go ahead, Amanda.
Thank you. Yeah, I'm going to just provide a pretty broad overview of what we're hoping to do with evaluation for the next cycle. But the most important piece of this is that we're really aiming to make evaluation, data, and monitoring a central part of the next CHIP process. So go to the next slide. And so, as I mentioned, we're looking to really redevelop the plan with both evaluation and monitoring in mind. And so what we're hoping this looks like is being really intentional about tracking two different components. So one is the process goals, and hoping that these will allow us to get to measuring the policy and systems change. So some of the things that we're looking to be able to measure and track and really pay close attention to are working on partnerships and engagement. And so some examples would be the number of partners per sector that we're engaging, and then also being really intentional about the quality of those partnerships, like how are we providing opportunities for shared decision making, the percent of partners that are continually engaged and come back, and then looking into other partnership evaluation tools to measure this. And then the next piece is looking at the flow of investment and resources. So as a looking at how much we are investing in the strategies that are aligned with the community health improvement plan, and how can we track and measure and align some of those resources moving forward. And then also looking at how we are incorporating performance improvement and quality improvement. How are we looking at how are the strategies going? How are we integrating changes based on feedback? How are we creating feedback loops to understand how we can continually improve the implementation of this, both the CHIP itself and some of the strategies that we're engaging. And then the other piece is looking at how are we evaluating the progress on the goals in the plan and the impact that we're having. And so we hope to do this through one, being sure to look at some good leading indicators of population health outcomes. So for example, for economic security, we'd want to, if we say that one of our goals is healthy food access, then we want to make sure that we have some measure of what the population health outcome related to healthy food access. Do we have more people that are being able to access healthy foods as a result of strategies in this plan? And so making sure to identify what would be the key overarching indicators of population health outcomes as a part of this process. And then the other piece, getting to more of that, what are the actual strategies that we're implementing, would be looking at action step tracking. So on the next slide, we have an example of what this could look like. So we're hoping to publish annual reports that would look at both our overarching goals for each of the priority action areas, and then looking at the action steps that we had identified with implementation partners as implementing for that year, and then taking a measure of whether there has been no activity or whether the activity has been partially implemented but not completed, or whether that, that strategy has been fully implemented. And so that we can look over the course of both a year and over the cycle at which of the strategies, where they're at in a quarterly time period, so that we can better identify where we are making progress on the goals outlined in this plan. And then you can see here that we also have some sample population health indicators. So things like increase the child food security rate or decrease the percentage of adults who report inadequate social support. And these would be closely aligned with the goals outlined in this plan. And again, so the deliverables that we're hoping to regularly produce would be both an annual report, which is the update on the progress and outcomes from that year, but then also hoping to develop some kind of dashboard that we could have on our website that would be more frequently updated to indicate some of the data points or action progresses that would move more regularly, so that we can have that information available and transparent for partners. And we're really hoping to engage many of the partners already engaged throughout this CHIP process, or bring new partners in to work on providing feedback and also helping to shape what this could look like. And so we're hoping to start this process next summer. And so right now, these are kind of the broad ideas of what we're hoping to do with evaluation. And very excited to dive in more what this could really look like, and what would be most useful for all of you as partners to have as information to track the progress on this CHIP. So thank you.
Thank you so much, Amanda. Does anybody have questions about that evaluation component, just generally before we move into the next session or the next piece? We'll also have time to chat at the end once we stop recording, but just wanted to open the floor. Great. Okay. So lastly, we're going to talk about opportunities for engagement. So if you've been a part of the CHIP process before, as I mentioned earlier, we have quarterly action team meetings. And so those are for our action team members. Anybody can join any of the action teams, whether it aligns with the work that they do in their organization, or if they have a personal passion, maybe they live in a neighborhood where this is something that they're focusing on. Anybody can join the action teams, but for 2022, because we're using it as a planning year, we're not going to have quarterly action team meetings. So we're going to provide different opportunities for engagement while we plan the CHIP, because this is a collaborative process. We want to make sure that we have as much community input and as much engagement from our partners as possible. And so in 2022, we wanted to make sure that we had something for partners to participate in quarterly, similar to the action teams, so that it's not like we're emailing you every single week, needing input or trying to get information, but so that we can stay in the loop with each other and make sure that we're keeping everybody engaged through our partnerships. So in 2021, as I mentioned before, we're currently going through our strategic planning process, and we will be passing out community surveys. And because the folks on this call and who are engaged through our CHIP, because you guys have been working with us, or even if you're new to this process, your work aligns with the priorities within our CHIP. And so we want to get more information from the community about what the health department could really focus on over the next 5 years through our strategic plan. So this is an opportunity that it's not quite ready today, but hopefully within the next few weeks, I can send out more information through our e-Notify newsletter on how to participate through that. So that's something right away that you can participate in over the next few weeks. And then again, in early 2022, we'll ask for some community input on the CHA. So that, again, that's the community health assessment. That's our data assessment. So before we publish, we'll release a draft of the CHA and we'll ask for some community feedback on that. In May, as I talked about the pilot for the MAP process, May will be about when we're starting the stakeholder and power analyses. So we will be asking for some community input on that. Maybe identifying different organizations or different groups that hold power, or would be good stakeholders to work with and to interview in our analyses. Over this summer, we will be asking for volunteers to participate in an evaluation work group. So Amanda gave a very great overview of the evaluation process that we're hoping to implement. When we create an evaluation plan for the next cycle, it won't be really set in stone until we know more about what we want to focus on. And so next summer, once the strategic plan and the community health assessment are released, then we can kind of solidify more what we want to focus on. So we'll bring together community partners for an evaluation work group to really have a strong evaluation plan that we want to focus on for the next cycle. Then in August, we'll have action team and or steering committee orientations for everybody, just to kind of go over the roles, responsibilities, expectations, again, like the different levels of engagement. So we will be recruiting throughout the entire year, and we recruit throughout the entire cycle, but to really have folks at the table who want to be part of the planning process, we'll make sure that there is an orientation for action team members. Then in October, participate in strategy alignment summit. As I mentioned before, we really want to bring everybody to the table to hear what the different plans in the community are and how can we align the work to each other and within the city to really improve health. And then throughout the year, we're going to bring together focus groups and then also do one-on-one meetings with health department staff. So I know a lot of folks on the call were new to the CHIP. And so having these meetings just to kind of touch base with us, get to know your organization, your role, your team, and to really bring together groups to talk about maybe what some of the issues are, and kind of a jump off of the activity that we did earlier, really talk more about like why is housing an issue of economic security, and who are the groups that are working on housing, and what are the different plans out in the community that focus on housing, and how can we really develop action steps towards strategies that are working towards population health indicators on housing. So things like that, more so than like a presentation like this, it'll be a nice focus group to talk through some of those pieces. And so this is what we're envisioning engagement to look like in 2022. And as the year goes on as well, there might be more opportunities. So we'll make sure to keep everybody in the loop. And the best way to stay connected to us is to sign up for the e-Notify newsletter. So this is the system through the city where you can register to sign up for newsletters on a variety of different topics. So if you live within the city too, you can sign up for like neighborhood alerts. You can sign up for emails from your alder. You can sign up for a lot of the offices and the different departments within the city. But our email list is called MHD Community Health Improvement Plan, CHIP in parentheses, updates. And so that will be how we send out a lot of the information if we're having meetings or pulling folks together for focus groups, or to sign up for one-on-one meetings, things like that. So if you need assistance with that, you can email me as well. I can drop my email into the chat so that you can make sure that you're up to date. And I'm going to go ahead and stop the recording. So thank you very much. Let's see, stop recording.